wonderful things that Build Back Better offers, including tax benefits for families with children, support for home care and child care for family members, lower prescription drug costs. I want to focus on a particular area, which is the addiction crisis, which grinds on in Rhode Island. I think every member of this body knows a family that has been touched by this crisis. I remember visiting the small town of Burrillville, Rhode Island, a close-knit community. People know one another there. And on January 1st, 2015, no one would have known that half a dozen people would die in Burrillville of drug overdoses in the next 3 months. That went through that community just in a heartbreaking wave, and it remains burdened by addiction and overdose. We've made a lot of gains since then. The CARA bill that Senator Portman and I did, CARA 2.0, which was baked into the Support Act, shifted the way we think about addiction, so we don't see it as a moral failing. We recognize its medical nature. We recognize, frankly, the noble nature of the path to recovery that people have to walk, and we invested in prevention and education and treatment. But still, there's a massive gap that remains between the needs of families who have a member who is facing addiction and the care and support that we give them. And Build Back Better makes some really important steps for those families. First, for new mothers in recovery. A new mom has a lot going on: caring for a newborn, coping with a potential substance abuse complication for that newborn, and caring for herself in her often deadly battle with her addiction. Build Back Better would grow the workforce specializing in that care for moms. The Medicaid Reentry Act, which I did with Senator Baldwin, is also in the mix to provide Medicaid coverage to people as they get out of jail and prison. We showed in Rhode Island that these programs dramatically reduce overdoses and deaths in the weeks following release from incarceration. Steady access to care through Medicaid will save lives. And there's a boost to the Minority Fellowship Program because it's demonstrable that a more diverse workforce produces better outcomes for patients and families. And finally, peer recovery coaches, a personal favorite of mine. We're pioneering this in Rhode Island. These are people who've walked the path of addiction and recovery, and they can relate to people who are struggling in a way that you and I may not be able to. And their role after an overdose or in a crisis to get people onto the path of recovery is wonderfully important. All of the other things we're doing will actually create more stable lives. And when events happen that knock people off the path of the recovery, having a stable life actually allows for a better shot at recovery and work around relapse. So there's a lot to love in Build Back Better, and I want people to know that we did not forget those folks who are struggling with addiction or walking the noble path of recovery. And I yield the floor.